If you feel like you're doing everything to help your child with ADHD, but nothing seems to actually stick, you're not alone. It's exhausting, it's confusing, and honestly, it can feel pretty defeating. And the worst part, most parents are sent down the wrong path from the start through no fault of their own. Before we dive in, make sure you watch this video all the way to the end because I'll be sharing the specific research findings that can change the course for your family. All citations will be listed at the end of this video if you want to check them out for yourself. Here's the good news. There is a clear, research-backed way to help your child build the real-life skills they need. It's not another round of talk therapy. It's something you, as the parent, can take the lead on, and you don't have to figure it out alone. The American Academy of Pediatrics makes it clear. Parent behavior training is the #1 recommended treatment for children with ADHD, especially those under 12. The Society of Clinical Child and Adolescent Psychology under the American Psychological Association agrees, listing parent behavior training as a well-established treatment on their evidence-based guide at effectivechildtherapy.org. Let's talk about why this matters. Talk therapy is not supported by strong research for children with ADHD because ADHD is primarily about lagging self-management skills, not emotional processing. Talk therapy focuses on insight and reflection, which can be helpful for emotional disorders, but doesn't teach the executive function skills ADHD kids need to be successful. Multiple research reviews, including the American Academy of Pediatrics guidelines, emphasize that there is no strong evidence showing talk therapy improves ADHD symptoms in children. Play therapy is not recommended for ADHD. It doesn't help build emotional regulation, executive functioning, or social skills, the core areas that children with ADHD struggle with. Research summarized by the Society of Clinical Child and Adolescent Psychology also finds no evidence that play therapy improves ADHD-related impairments. Cognitive behavioral therapy, while it's highly effective for adults with ADHD, research shows it's less effective for children. Young kids don't yet have the abstract thinking skills or the executive function skills CBT requires to benefit fully. Some research shows that CBT may start to show some effectiveness for older adolescents around age 14 and up when they have developed more metacognitive and abstract reasoning abilities and if they're motivated to participate. However, for younger children, CBT alone is generally not sufficient to address ADHD symptoms. The reality is that most medical and mental health professionals aren't trained in the latest ADHD treatment guidelines. They often refer families to the types of therapy they're familiar with, not necessarily what research shows works best for kids with ADHD. This is a systemic issue. Families aren't being given the right information, and it's not a reflection of you as a parent. ADHD Dude's parent training programs are built directly from these evidence-based recommendations. We add an even bigger focus on executive functioning skills because your child needs more than behavior change, they need the ability to manage themselves. This is about building skills in a practical, doable way. If you're ready to stop spinning your wheels and stop spending time and money on ineffective treatments, you finally have a clear path forward. You already have what it takes to lead your child, you just need the right roadmap. Join us at ADHDdude.com and don't forget, all the research cited today is listed at the end of this video. The last thing I want to tell you, families who lead with knowledge and strategy see the biggest growth, and we'll show you how to get there.